Patient identification is important to me for two reasons. As a clinician, it's making sure I'm doing the right assessment on the right person. And I also think it gives it a chance for the patient to be involved in making sure that they're getting the right thing done to them.
But you're always seeing different doctors at different times. So I found that the mistakes have happened for me in the past. So that's why I think it's pretty important that you make sure that you check everything before you do anything to a patient.
As a manager, it's also making sure my staff are meeting medico-legal requirements and clinical handover requirements. There are a couple of ways with patient identification that we see every day. So a big component of occupational therapy is cognitive assessments. The first thing you're going to do if someone has some cognitive impairment is check that you're doing it on the right person, and sometimes it's not uncommon for people to not be able to tell you their date of birth or their full name. They might just be able to tell their first name or their last name.
I have had issues with people not checking my chart. I have severe allergies to some pain medication and also to antibiotics.
I guess it's making sure that staff are educated to check the three identifiers, so you are, patient name and date of birth, and building that into your department orientation or competencies so that it's something that they practice when they are learning a new assessment or learning a new technique, that they automatically check that they've got the right client that they're working with. I guess the easiest one is someone who has some cognitive impairment. When you're looking at doing some assessments, we'll go towards a legal capacity. We've had clients who will say yes to everything. So, is your name Mrs. Smith? Yes. So if you don't ask the right question, so what is your date of birth, as opposed to is your date of birth this? I guess the other is we go out to people's homes and actually assess people's homes. So we need to make sure we're going into the right property for the right client.
And didn't check my chart. And if it wasn't for me asking what she was giving me, I could have ended up dead.
It's not uncommon to find people who've got the same names and same date of birth. And it is interesting when you go talk to someone and you start a conversation and they go, I don't have a hip replacement, and you're thinking, oh, have I got the right person? I better go double check that it's Robert Smith A, not Robert Smith B. So it's an important thing to do.